Well, you might wonder why we have to define patient in our name. That's because everybody's been a patient. But you know, in PaCER, it's not just the fact that we've gone to the doctor. It's because we're willing to wear the patient hat when we come into the room. That's what distinguishes a patient in PaCER from any other health researcher who's also been a patient. It wasn't until we actually started figuring out what our name was going to be, so it was Patient and Community Engagement Researcher, that we realized that the patient wasn't the focus. The focus for the people taking the program were researchers. So we were Patient and Community Engagement Researchers. And to me, that really puts it in a whole different tone. So yes, they are researchers who are working with patients and communities to engage them in research. But it also put them in a very nice position of being both. They were a peer. They could work with people one-to-one. People could recognize that they too had had that experience. So they were able to trust and to form a relationship that allowed them to explore their experience rather than tell their experience. The really important thing here is, I guess, the fact that they could see automatically that the patient researcher had their voice. They would speak up for patients, and they would make sure that their research made a difference. The reality is that the strength and the resilience of patients and their communities need to be part of what we call the health care system. It's not just about pathology. It's not just about illness. It's not just about finding ways to make people survive. People come into those conditions, and through them they grow and they change. And it's important that we learn how to incorporate that strength to make our healthcare system more effective and more useful in the future. We're not going to be in this kind of a system forever. We can't afford it. The healthcare system of the future will be one in which patients and their families have much more say, are, say, a stakeholder in healthcare, and will become a new social movement as patients.